So, good afternoon, everyone. Thanks for joining the session for profitability and cost management for healthcare. My name is Harshal Shah. I'm assistant vice president at Evosys. My primary responsibility is around EPM as well as in healthcare. With me, we have Matthew Savard. He's a director of analytics at Adventist Health. He's going to, talk about his journey on moving to, profitability and cost management for patient level costing, DRG, charge level costing, and how they are using profitability and cost management for last 3 years, and what's the roadmap. Uh, so I'll quickly move on to the agenda. So we'll talk briefly about Evosys. We'll give you a quick overview of who we are. We'll talk about some challenges around healthcare organizations, specifically in the current situation where elective procedures are getting delayed, and most of the healthcare systems are busy in treating COVID-19 patients. So we'll talk about that, and we'll talk about how this solution can help healthcare organization in taking right decision using certain set of information. I'll then hand it over to Matthew to talk about his experience with Oracle set applications and his journey with profitability and cost management. We'll move to the solution demo. We'll quickly give you a outcome that organization like Adventist are using, and how they and the decision they are taking on using this solution. So there is a lot of calculations built behind that solution using EPM set of applications. And at the last, we'll take question and answers if you have any. So Evosys, we are a cloud premier partner. We have presence across more than 30 countries now, and we work across all the Oracle modules. So whether it's ERP, EPM, SCM, you talk about Oracle set of application, and we have our skill set and our team working on the Oracle set of application. We have more than 1,500 consultants on our payroll. So we do not get engaged into contractual, or we get the project and we get the consultant. We have people on our roll, so that let's say whenever there is a project coming in, we deploy this consultant. From the cloud perspective, I mean, in last 7 to 8 years, we have partnered with more than 1,000 customers to whom we have helped to move to the cloud, whether it's ERP or from Hyperion to cloud, or from SCM to cloud. And of which more than 150 customers are in healthcare. So those are someone like Adventist Health, Fenway Health, Providence in Seattle, and there are some smaller clinics as well. Yeah, and we have a kind of a predefined program on the customers which are on Hyperion or which are on on-premise, to take them to the cloud. We have an internal program called Glide Insights, which helps customer to understand the return on investment of cloud applications. This is a quick recognition by Oracle. So we are well recognized within Oracle. We have been getting awards. So in 2017, we got Global ERP Cloud Partner of the Year, and in 2019, it was on the SCM side. Again, for last 5 years, we have been quite popular in terms of getting award from Oracle across the globe. On the Gartner side as well, we are pretty much recognized in the Gartner's Magic Quadrant. So if you see the 2019 and 2020, we are making a progress toward challengers and the leaders quadrant. So that way, we are one of the top 20 partners that you have for Oracle Cloud applications. Now that's us. And let's get into the meat of the discussion. So in the current situation, the challenges that healthcare organization face are kind of two-folded. So on the one side, you have healthcare organization pressure of maintaining a consistent revenue, or making sure that they are not overrun by the cost. And at the same point of time, they also have to make sure that the patient inflow, they need to manage the patient inflow. Now this set of patient inflow are not something who will come for the elective kind of a procedure. These are more like a COVID-19 patients, or more are more like of outpatients. And what it does is it does require you to give enough attention to this patient, but at the same time you are not going to, or as a healthcare organization, you are not going to earn as much revenue as you would from the elective procedure. And what it has done is it has resulted into the sharp fall in the revenue. So if we see past 6 to 8 months, most of the healthcare organization has postponed their elective procedures. And let's say if they have not postponed, but the patients are postponing it by themselves because they are afraid of getting into the hospital environment. uh, and what it has done, it has reduced the revenue, uh, and at the same time the cost is either as it is, or it has not reduced as significantly as revenue. So again, there is a huge cost pressure on the organization to make sure that by the time we reach to an end of this pandemic, we are not completely broken. uh, Again, a lot of uncompensated care cost. So this, when this situation came up, again, many insurance provider has not either accounted for this kind of charge codes, or many insurance provider doesn't pay for this. Now, so effectively, yes, patients are paying out of their pocket, but there are hospitals who are also absorbing this kind of cost. And that's where you have uncompensated care cost, as well as the huge amount of bad debts of not getting money back from the patients or from the insurance providers. Again, there are always challenges around billing, coding, around billing and coding. And overall, if I consolidate and summarize this, effectively the healthcare organization are having a kind of a negative outlook. Yes, it has started moving to the positive while when we have started opening up, but absolutely, if we see next 12 to 18 months, uh, it would take time for any healthcare organization to reach to a level where they were probably 12 months back. And what could help in this situation is to have a solid solution which can help you to get a realistic financial numbers or financial forecasts. So rather than depending on different set of assumptions, you need to use some historical data, you need to use some realistic facts to drive your financial decision. And that's what we bring to the table. So as a Evosys, we have utilized Oracle's EPM and analytics set of applications, and created more than 250 set of analytics and reports that gives you a detailed understanding of financial data as well as the operational data. A quick overview of the solution. So if we talk about the solution, it's extremely important to have a quick analysis around population health. Uh, Again, giving the example of COVID situation, it was extremely important for the healthcare system to identify which age group is getting most affected, what race is getting most affected, and what could be potential vaccine, if not vaccine, potential medication around that particular age group, or a particular race or ethnicity. So having this kind of analysis right in front of you on a real time basis is extremely important. Uh, what we have is a solution around the contract management. So effectively, for hospitals or for healthcare systems to have an effective revenue model, they need to look at their contract information very carefully. They must combine the contract negotiation with the cost information that they have, the revenue information that they have. And again, if we try to look this in the silos, your negotiation with the payers, your negotiation with the government authority would not be as efficient as it could be. Uh, again, on the healthcare analytics, there are a lot of analytics around benchmarking, around scenario modeling, around what if analysis. So we'll talk about that piece as well. There is a quick solution which we have developed, and I'm sure Matthew would talk about that, is around scenario modeling. So I mean, if I go 4 months back, where we didn't have much clarity on how COVID-19 is going to pan out, uh, most of the finance controller or the finance directors wanted to have multiple views on the EBITDA. So they wanted to understand, let's say, if situation gets back to normal by December, how it is going to impact how my EBITDA is going to look like. And let's say if it continues till, let's say, 2021, how it's going to impact my EBITDA. So that kind of analysis was extremely helpful for financial controllers. So that is something which we have developed and is available to use. We use a lot of AI algorithms to drive the supply chain. Again, what kind of items you would need at what time and what season. So that's something which is predefined in the solution that we have. Again, most important piece. So these are something which are more on the analytics, but again, all is driven from how you derive your patient level cost and the physician level cost. And historically, Oracle has not been seen great with a healthcare costing kind of solution, but with the EPM cloud, with the set of modules they have, I think it's pretty much easy and scalable to have profitability around patient, DRG, CPT, and even physician level margin analysis on the EPM set of modules. And as an organization, let's say if you are part of 340B reporting or 340B, we have solution that gives you a quick understanding on how you are doing on 340B. So again, this is a quick summary of the solutions. Absolutely, there is a details around each of this. I'm going to touch base on the demonstration probably for 10 to 15 minutes. But yeah, at any point of time, if you guys need to go into the detail, I'd be more than happy, to connect you offline as well. With that, what I'll do is I'll hand it over to Matthew to talk about his experience and the roadmap. So yeah, Matthew, take it away.
All right. Thanks, Harshal. Thanks, everybody, for joining this afternoon. I was watching the intro, and man, I am feeling old today after some of the throwback-themed TV show trivia and whatnot. So thanks, everybody, for joining the Solutions Conference. It's an honor to be here today. I'm going to turn off my video as we dive into the presentation, do an introduction to where I work, but wanted to just say hi to everybody visually and encourage you to send in your questions throughout the presentation today. We would love to take some questions at the end. So without further ado, I am part of Adventist Health. And you can see on the slide here, our mission statement is living God's love by inspiring health, wholeness, and hope. So from that, you can probably ascertain that we are a healthcare organization and also a faith-based non-for-profit organization. Part of our mission is that we not only care for patients' physical health, which is what you would expect from a healthcare provider, but also we look to care for and restore holistic health across both hope and spiritual fulfillment for each of our patients. As a healthcare provider, we operate 23 acute care hospitals across Oregon, Hawaii, and most of our facilities are in California. Our team includes over 37,000 physicians, nurses, health professionals, volunteers, and even a few hundred finance professionals such as myself. In addition to our acute facilities, we operate 8 hospice care agencies, providing over 75,000 hospice care days each year, as well as 15 home health agencies, providing over 200,000 home visits per year. We also run one of the largest rural health systems in the nation, with 68 clinics providing care in rural communities. And in total, we operate nearly 300 clinics with over 1,200 providers covering 54 different medical specialties. So we're a full spectrum of care that we offer across multiple settings. So jumping into where the company was when I joined, in 2017, we were in the middle of what we refer to as our business transformation. Some of you may recognize that soothing green screen on the right-hand side of the slide here. We had been using legacy systems such as AS400, which is what that soothing green screen represents. We've been using these legacy solutions since the 1980s. So that's part of the larger business consideration that went into our business transformation. Specific to cost accounting, our cost accounting application was 3 annual patches behind because of server limitations that we had. So every time I talk to the vendor and ask, hey, could I do this? Sure, if you could do that if you were on the most recent release. Well, I can't get on that release because my servers needed to be updated first. And so that was kind of the situation we found ourselves in. Because of this aging infrastructure, we weren't able to take advantage of the functionality that was out there on the existing tools in many cases. And because of these factors and others, we decided to pursue a cloud-first approach to our new software selection as part of this business transformation. Given that where we were coming from and the strategic vision we had for our future, through the selection, we placed a high priority on new cloud-based business applications that we could easily scale. We were in a phase of rapid growth through acquisitions and mergers and partnerships. So we needed to be able to grow these applications once we got them in place. And when I refer to easily scalable, I'm not only talking about scalable from a cost perspective with minimal cost, but also from the technical perspective, looking for our teams to be able to learn the application and support that future expansion and development with limited external support. We're also placed a high emphasis on modern user interface and consistent user experience across those applications. As you could see, we were coming from some very dated user experiences, and we wanted to provide cutting edge experience for customers. So. All right. So our business transformation journey began in 2017. We selected, as part of our review and selection process, Oracle Fusion, ERP, and HCM. Subsequent to that, we selected PBCS for our annual planning application, also went live with that in 2017. Next up, we addressed our legacy cost accounting application by adopting PCMCS. And as part of that PCMCS solution, we also adopted OAC as our primary platform for supporting financial reporting and analytics across the organization. The solution design in PCMCS leveraged the clinical data sets that we have in our Enterprise Data Warehouse, or EDW, and combined those utilization details at a rolled up level with the general ledger details from Fusion ERP in the PCMCS costing application. After combining all those details in profitability and cost management, we create a fully loaded cost per CDM. That cost per CDM is delivered back to our EDW for reporting. We marry it up with the patient level detail that we have in the Enterprise Data Warehouse and create classic cost buckets that you would expect to see by patient and by charge. Through this implementation, we took a phased approach just so that we could allow for feedback from the initial phase so that we could incorporate it in future rollouts. So we took a 3-phase approach. The first phase took us about 9 months for 3 hospitals, building the solution from the ground up. And then subsequent phases to cover the rest of our 17 facilities took 3 to 4 months each. So how did we come to the selection of PCMCS, or Profitability and Cost Management? We went through a selection process that was much longer than I had hoped or expected when I joined the company. But over 6 months, we evaluated multiple healthcare cost accounting leading vendors. We looked at industry leaders such as McKesson, EPSI, and Strata. In the end, we selected PCMCS combined with OAC based on several factors, including the lowest 5-year total cost for our organization. Again, looking for something that was easily scalable with minimal additional costs as we expected future growth. We wanted a cloud-hosted solution, which was fairly new in the space when we were looking at this 3 years ago. There were limited options there. Obviously, that modern reporting function and feel, and then an integrated tool set consistent with the other Oracle products that we had already implemented, which gave us the ability to get up to speed quickly and leverage some of the experience our team members already had with the Oracle interface. So in selecting a partner, we also reviewed proposals from multiple industry leading partners. In the end, we selected Evosys for PCMCS based on recommendations from Oracle Product Management, healthcare, based on their Evosys's demonstrated healthcare industry knowledge. We were also impressed with some of the pre-developed reporting content, which Harshal's going to give you a demo on shortly, that was able to demonstrate for us their knowledge of our industry and give us confidence that they understood the type of customer needs that we were trying to address through the project. They also bring a large team with diverse experience, which was a benefit to our project as we move through it. And last but not least, competitive pricing. Some of the benefits that we've achieved to date, one of the primary benefits we've realized is that we have broader reliance on the data that our team is providing. So we had previously been delivering cost accounting results for about 5 years at Adventist Health, so starting in 2012, 2013. However, there was a lack of confidence in the results and of general feeling on the team that it was a bit of a black box they were working with. So we have much better visibility for our team into the processes taking place, and therefore much higher confidence in the outcome from the leadership team across the organization. As a result, we're able to produce routine service line reports that our executives rely on. These reports are used regularly by our teams to evaluate new business development opportunities, understand the expected impact of our strategic investments, and we've also been using it to evaluate some of the financial impact of our community wellness investments. In some of those rural communities that we serve, we have programs that are targeted to underserved populations to provide the appropriate level of care and prevent ED admissions, for example. And we've been looking at ways to measure the impact of those programs by looking at the cost of care for those patients prior to intervention and post-intervention. So lots of exciting applications for the data set. We've also seen growth in the area of service line, self-service rather, analytics, and we expect continued growth in that area as we move forward. We have been able to successfully integrate new facilities onto our platform, which was really important to us. And we were able to do that largely with internal resources without any outside support. So we're really excited that our teams have that skill set and are able to grow the solution along with our organization as we expand. So what's next for our team? In Q1 of 2020, so we just completed the migration of our existing OAC Classic applications, including the BI dashboards that we created in OAC to support cost accounting reporting, as well as SBase Cube and our DV products have all migrated to OCI Gen 2. This allows us to leverage additional auto-scaling and autonomous features for both analytics and our database applications. In Q3 of this year, we went live with a new rolling forecast project in PBCS. We expect this will further shorten our annual planning process and, more importantly, give us the ability to respond quickly to changing business situations with a plan that matches the current operating environment. So as Harshal mentioned earlier, rapidly changing business environments. Typically when we complete our annual planning and roll it out, about the time we get finished with it, the executives are asking us to update it because of the changes to the business environment that have happened since the plan was completed. So looking forward to continuing to grow this rolling quarterly forecasting process to provide us updated and timely targets that are adapted to the ever-changing business climate we operate in. Another exciting project that we have coming up is our work on pushing our cost accounting solution to real time. What we're doing there is attempting direct costing for some components of our labor by leveraging some new clinical data sets and applying costs directly to the activities that drive the expense from a labor perspective. We're excited to continue to push forward on these new ways to apply cost, both in additional opportunities within the labor space and supplies. And the flexibility of PCMCS to support that work and allow us to continue to evolve our solution has been a real benefit to us, and we're looking forward to continue to leverage that into the future. With that, I want to hand it back over to Harshal for a demo of the functionality that we have.
Thanks, Matthew. Appreciate it. All right, so I'll quickly move into the application. It's a Oracle Analytics application. So as Matthew mentioned, the costing solution is the combination of PCMCS and the OAC. OAC being a reporting side of the area, and PCMCS is more on the cost allocation side of the area. So what I'm going to show you today is a set of analytics that we have developed already, and these are something predefined. So effectively we are not building anything from the scratch. So once we have the data pulled in from your, let's say, EHR system and your GL, and when the cost model is run, all these reports will be populated with the information that of yours. I'll quickly go into the profitability analytics, and as you see, there are quite a few dashboards you can see on the top. You can analyze this information from the operational side of the area. So if I want to analyze number of cases across my multiple hospitals or multiple MSTRGs, I can do that right from here. And this information come directly either from Cerner or Epic or Allscripts or Medtech, whatever EHR system that you use. Again, the same information you can analyze by different facility. Currently, I have this analyzed by different states, but you can analyze by different location or different clinics or different facility that you have. And at the same time, you can analyze, this information by payer. So all these numbers and something are post allocated numbers. So these are, now what I'm looking at here is number of cases. Now, I'm not interested in operational data, and if I'm interested in financial data and I want to look at net revenue, so I just change this information, and all this information will be updated with the net revenue numbers. Similarly, if I want to understand, what is my average length of stay, again, across multiple departments, across multiple facilities, I can do that. So it's pretty much easy to use for you or for the financial or the operational uh, team. And all this information are updated, as soon as the data is populated in the data warehouse. Uh, this is more of a summary. You can go into the details around profitability. So let's say if I want to look at my my profitability, I can look at my profitability across different departments and how it makes up the total. So again, the waterfall chart, I can analyze how much revenue I'm earning from each of the department. And let's say if there is a department which earns a lot of revenue and you want to exclude that from your analysis, you can just do that by excluding that from here. It's just click there and all this will be updated. The best part about this is this information. So as you see, these are the different departments or service line you have. These are the number of cases, the CMI index, how much was the gross charges, was the net revenue, and the cost which you see here are more like a allocated cost. So this is not something it's coming directly from the GL. This is the cost coming after allocating the overhead cost and getting cost at the service line level. And the best part is you can actually go down to the lowest level of the information. So let's say for all I have 75,000 cases. I want to go into these cases. Just click on that and it gives me the information around DRG. So for how did 75,000 makes up. So here you have all the DRGs. You have different side of information. You can further go down into it. So let's say if I want to further go down, I can go down into cases and it will give me the details around encounter. Now, again, in each encounter, if I want to further analyze, let's say this particular encounter, I can go down and it will give me how many procedures, how many lab procedures have been conducted on this particular patient, how much consultancy charges have been applied on this patient, and what is the revenue charged. So you'll see the cost, you'll see the revenue, and if you want to again further see the drill of this cost, how this number came up, you'll be able to see that as well. That 1458 is made up of 725 from salaries and wages, this number from fees, this contractual labor, and so on and so forth. So all this information is not something you will have in your in your GL at this level. So again, all this are something which is a work we do using profitability and cost management and OAC. So for someone like CFOs or VP of finance or finance controller who wants to understand how each service line is doing, and let's say if there is a huge cost around salary and wages in one service line compared to another, they want to understand what are the reasons behind it, whether it's a physician who are taking a lot of time behind elective surgery, or it is probably pharmacy or a drug cost which is causing a higher cost against the revenue. And this information would be extremely helpful because the payers are going to pay you based on a certain reimbursement percentage. So for you, there is no, I mean, you just cannot charge higher if you are having a higher cost. So you are going to have a specific set of reimbursement percentage coming from the payer. So effectively, the finance team would need to know that how they can curtail the cost if there are any high costs again or around any area. Yeah, I see some questions. I'll take this, at the end, so that we don't have we don't need to wait on this. So again, we have charge cost analysis. You'll have some analysis around medication and supplies. So all this information is easily available. Medication dispense analysis, and all this number, what you see, wherever there is a drill down available, you can drill it down. You can look at medication supplies like top 10, top 50, just change it to 50 and you'll see the 50 top medication CDM lines. You can do a quick analysis around physicians. So let's say many healthcare systems have multiple physicians for similar kind of surgery or procedure. So at the end of the month or day, if you want to analyze how much a physician is spending behind one specific elective procedure, you can do a quick comparative analysis. So you can select the physicians in here, and you can see the cost analysis or probably margin analysis against specific DRG. So this is for heart center. You can have this similar for different departments. So quite a few predefined set of dashboards. So what you need to do is just have the cost allocation available, and you'll be able to get all this information. Quickly on the contract side, so this is a contract management. Most of the healthcare system have different department dealing with this, and again, it's not something which is effectively being managed on applications. And most of the hospital we have worked with, they are managing this either on Excel or some Access databases. And that's where what we do is we try to combine the contract management solution with the costing solution. And what it will do is it will help you to analyze or negotiate well with your payer. So now this is a quick example. Sorry. This is a quick example where I have reimbursement information and I have margin by payers. In the table below, what I have is, these are the different DRG code, and these are the different payers I have. And this is a specific facility. Now let's say I want to do a quick what if analysis that my current net margin with the current reimbursement, 80% reimbursement is coming to this. Now I want to change my, let's say, target net margin for all the specialities to probably, let's say, 30%. So I'll just change this. And as soon as I do that, system will give you that what reimbursement percentage I should have for each DRG code against each payer to have a net 30% margin. And other way around is also possible. So if you want to negotiate reimbursement percentage and I want to see how much it is going to impact your net margin, you can do that as well. So let's say if your net margin gets changed to probably, currently it's 80%, which is again not possible, but yeah, if you want to change it to 20% or 30%, how it is going to impact your net margin. So all this stuff you can do right in front of you without having to depend on multiple Excel files or going back to the data and doing a lot of manual manipulations. Again, we have very limited time, so this is extremely high level, but yeah, absolutely happy to have a follow-up and show this to you in detail. This is more on the profitability. We do have a similar analysis on the reconciliation, on the supply chain side, on the costing, the revenue cycle. So all these are predefined set of dashboards which are available. With that, a quick summary of the benefits that we get with the solution. So Matthew mentioned around having a self-service way of reporting and having confidence in the data. So with this solution, I mean, you can pass on the access to your end user who can see the data, who can drill down based on their security or the access roles and responsibility, and they will get the confidence in the data. They don't need to depend on IT or finance team to send the information in Excel. Uh, uh, I mentioned about having an effective contract negotiation on you can compare how much you are getting from each payer and then ultimately agree that with which payer you want to negotiate how much. Uh, Currently this negotiation happens again based on a lot of facts, but all those facts and information are on either emails or on paper. But with the solution which I just demonstrated, you will have the facts in front of you on the screen, and those facts are getting updated on kind of a real-time basis once you as soon as the data gets added into the data warehouse. You'll have a single platform, so you do not need to go to multiple places to see multiple information. All the data is auditable and traceable, so you will be able to see which data is coming from where. And yeah, the real-time EBITDA analysis, at any level. So again, if you want to do at patient level, you can do that, or DRG level, or the most granular level you want. This is a more advanced. So let's say if you want to give a kind of a advanced feature to your executive team and want them to have look on the revenue or the other set of information on mobile, these are the digital assistant chatbots we have deployed on top of profitability and cost management and other EPM applications. So this is more for executives to make their life easier in terms of getting the information without having to log into the application. The execution is going to be faster. So if we say historically, replacing a costing system or probably implementing a costing system used to take a lot of time. But with the predefined set of models, predefined set of rules, RVUs, and the calculations available, the execution or the results which you are going to see becomes much faster. So you do not we are not going to develop things from the scratch. That the model is available, the reports are available. What we are going to do is work with you, make sure that you understand the model, make some tweaks in the model as per your specific need, and that's it. You will end up spending time in kind of reviewing the data rather than we configuring the application. And with that, I'll quickly move on to the question and answer. We have 4 minutes. So
Sure. So you want me to take a stab at the questions first, Harshal, and then I'll see if you have something you want to add on each of them. Okay, great. So first question we have came into the chat earlier, so hopefully we addressed some of this, but we'll take a stab at some parts of it as well too. So looking for more detail around our actual use case and some of the challenges that we encountered. So the use case for us was understanding both cost and profitability at a charge level detail. That was really key for us because getting down to that lowest level of grain at charge level allowed us to look at profitability by department. So our prior cost accounting solution looked at cost and profitability by encounter or patient, which is common in the industry. So we wanted to be able to do that as well. But the challenge with doing that look only is that our patients frequently receive services from multiple departments. And a lot of times we want to look at profitability and cost specific to a department as well. So we had to push both our cost and our revenue down to that bottom level charge code, which was also the level at which we developed our RVU system. And some of the challenges that we encountered there were the ones that are coming to mind right now is around establishing the right level of detail to create RVUs at. So, for example, we have about 30,000 CDMs that are used across the organization. And those CDMs are often used in multiple departments. And we found ourselves, we were attempting to leverage the existing RVUs we had in our old solution. And sometimes you get CDMs that are of a particular type and cross multiple departments, and you could have a disconnect in RVUs. So it was really helpful to talk through the options with our partner and come up with the best solutions for us given the size and complexity of the implementation, finding the balance of what we could maintain going forward between standardized and customized levels, looking at different slices of the grain on the data. So. Harshal, if there's any common challenges that you've helped clients overcome or anything you want to add to that?
No, I think you covered it well, and I think that those are the common challenges, right? Having to have a standardized approach of costing and making sure that it's not only standardized, but it's also scalable with the growth of the organization. So absolutely, that's what we did with not only Adventist but other healthcare organizations as well. So yeah.
The second question we have that came in is why OAC was used with PCMCS versus only using PCMCS. So a couple of factors that I would point out there. So first, in healthcare, we have a very high level of security required around our patient level detail. And so the comfort level with moving that across multiple systems was, the desired solution is to move that as little as possible. So the initial design we had was to take only the summary level details we needed from our EDW without any patient identifiers associated to them and move that into PCMCS for the allocation process, and then return the RVU results, a per click, if you will, from PCMCS back to the EDW, where we married that up with the cost accounting, or the patient level detail rather. So a lot of the looks you want in healthcare costing are dependent on patient level details, such as diagnosis. You want to look at how much joint implants cost across the organization, or those type of things. So you need that patient level detail in order to stratify the results, but you wouldn't necessarily want all of that detail in PCMCS, both from a data security perspective, but also more importantly, probably from a performance perspective for the allocation application. And then the other piece that I haven't mentioned is licensing. So we have a very small group of users that actually need access to PCMCS in order to do the allocation process. We have a much larger target audience that needs access to the end results. And so we didn't want to buy a bunch of seats in PCMCS to do reporting there when the users are already provisioned in the EDW and OAC for the visualization they need. So those are a couple of the key drivers there for us.
Right. Yeah, and the one point is on the volume of the data. So as Matthew mentioned, we are talking about patient level record, and we are talking about million lines in a month, right? So I mean, when we did Adventist, probably 3 or 4 years back, I guess. I mean, we are talking about almost I don't know, 10 million lines, Matthew, probably, or more than that on a monthly basis. So it was more of a transactional data, which only a data warehouse could handle, and that's why PCMCS had to marry with OAC to have an effective solution on top of what Matthew has just said. So,
yeah. All right. I don't know.
Okay, great. Any more questions for Harshal and Matthew? Doesn't look like it. Thank you guys both so much for a very interesting, informative presentation. I want to encourage everybody still on the line, join us for Solutions Jeopardy at epm.bi/Jeopardy starting now. And it looks like, Harshal, you've got a closing slide.
Oh, that's it. I mean, that's my information. Anything, anyone want to reach out to me or Matthew, feel free to write back to us, and we'll be more than happy to,